Today, I'd like to discuss the effects COVID-19 has on the pediatric population. The CDC reported that 6,800 children have died from COVID-19, and this is about 0.3% of the reported cases based on 2.3 million that has been reported in 78 countries. So with that number, it's not a significantly high number, but it is a notable number. The infection rate among the pediatric population is about 14%, which personally I think is higher because most pediatric patients are asymptomatic or just have mild symptoms, such as runny nose, cough, or congestion, which is often overlooked and thought of as a common allergy or common cold. And so I definitely think that that number is significantly higher. The question now becomes, since there are mild cases with the pediatric population, or some are even asymptomatic, why is it important to vaccinate children? And that's a valid question that I hear all the time. There are several reasons. One is that children are super spreaders. So especially in the Caribbean, when we live in multi-generational household, we are around our grandmother, our aunts, our uncles who has comorbidities such as diabetes, hypertension, obesity. These children that are probably in school or are playing with friends and has what everyone thinks is a cold could very much have COVID-19 and bring it home to a family that's vulnerable. It may not have a severe effect on the child, but to the vulnerable population, it could result in several, like Dr. Lewis just said, renal failure, death, and other severe illnesses. My family, my daughter was diagnosed with COVID-19 during the pandemic, and her symptoms were mild symptoms. She basically had a runny nose and headache, but we quickly identified that as possible sign of COVID. So we had her tested and she was positive. We were able to quickly isolate her. For 10 days, she was in quarantine in her bedroom, and we were able to prevent infection to the rest of the family. That was important because both my husband and my daughter has asthma. And of course, with those chronic illnesses, it could have had dire effect on them. So the fact that children are super spreaders, that's a major reason why children needs to be vaccinated. The most daunting reason, however, is a complication that we're seeing called MIS-C. And MIS-C is an acronym for a multi-symptom inflammatory syndrome in children. The pathophysiology of MIS-C is not fully understood. A lot of research is still needed in that area, which is why it's even more important that we are aware that that exists. The complication usually starts after the acute phase. So the acute phase of COVID is usually the acute phase ends after about 3 weeks. At that point, the clinical presentation are usually fever. Fever usually is for about 3 to 5 days. There's gastrointestinal symptoms such as abdominal pain, vomiting, diarrhea, and the children often present with a red rash that covers the face and the trunk and the arms, and also conjunctivitis, which is what we call pink eye. Not every child has all the symptoms. Some may have maybe 2 of those symptoms. And however, in the emergency room, which I work, most of these children present in shock. So their blood pressure and their heart rate, the blood pressure drops, the heart rate becomes elevated. And so it requires blood work to confirm that they have antibodies against COVID. One of the things that's amazing about this is that 90% of the kids that I see, this is not statistic proven, it's just based on my experience. Most of the kids that has MIS-C, their parents will report that they weren't aware that they had COVID-19. So they were asymptomatic children who no one knew that they had COVID-19, but when we do the antibodies, they come up positive for the antibodies. And most of these children require ICU care. They have to stay in the ICU until they're stabilized. The average age for these cases are, say, between 6 and 12 years old. And for some reason, Blacks and Hispanic are disproportionately more affected. So it is important that early recognition of MIS-C, is done in the clinical setting, and this will, prevent a better outcome. The other reason why kids are affected by COVID-19 is the psychological effect that it has on them. I've read a lot of research on the psychological effect, and I'm going to mention two. One was done in China. We haven't had a lot, I guess China is where the COVID-19 started. So there's a lot of research that's done on the impact that it's had on children. A research that was done in the end of 2020, the participants were children aged 7 to 18, and it was a large study. It had about 8,000 participants. They checked for different psychological illnesses, such as depression and anxiety. And the research showed that 43% of those children had clinical signs of depression, with 37% having anxiety. Another study was done in Italy and Spain. Once again, it was done in areas where COVID had hit first. And this one included the parents were the participants. So it was a large study also, had 1,143 parents. And these were parents who had children between the ages of 3 and 18. 85% of the parents reported that their children were showing signs of anxiety, difficulty sleeping, irritability, restlessness, and the parents themselves were reporting that they were having anxiety and depression as a result of the added responsibility with taking on schooling, remote learning, and having to address things that were normally addressed in the classroom. And then when you think of the classroom, the social development for these children, most of the things that we take into the workforce, they were formed and developed during school. We learned to participate in organized sports, which helps even in the workforce when we need to work with a team. Outdoor activities such as soccer, Carifta games in the Caribbean, champs in Jamaica, those were all canceled. And so these children were left with the things that were important to them. Outdoor activities, school, were all taken away. And I know in an emergency, in a pandemic, that was necessary. However, now that we can do something about it, now that we have the opportunity to get back to normal, as parents, as adults, we have to take advantage of this opportunity. In terms of like remote learning, I can just think of the outskirts of the island that I'm from, the outskirts of Jamaica. Wi-Fi access is difficult. And if you have 4 kids, most likely you have 1 or 2 computers in the house. So for 4 children to do school work when there's only 2 computers available, that alone is a stressful situation to add on to the fact that they're not having one-on-one interactions with their teachers. So the other area also is nutrition. Some Caribbean islands provide lunch programs for kids who don't always have a balanced diet at home, who are not able to, who are families who aren't able to provide nutritious meals, and they depend on the supply from school that they get. And they are also, families who lose their jobs, they lose wages, that will result in food insecurity. So it's a ripple effect. COVID-19 may not, affect, or there's not a large amount of death for the pediatric population, but they're severely affected. And so as we are today, there isn't a vaccine in the Caribbean that is approved for children. However, we know that it's approved for adults. And it's our responsibility as adults to get our kids back to normalcy, to get our kids back to enjoying life and making the best of their opportunities. And that's basically my plea today is my entire family is vaccinated. At this point, we are planning a trip to Jamaica for the summer. We're planning a trip to St. Kitts for December. And we want to embrace life and allow our kids to thrive the best way they can. And I implore you guys to do the same.